What's the difference between pandemic, epidemic and outbreak? The World Health Organization has declared COVID-19 a pandemic. This is a landmark event. As an epidemiologist listening to the steady stream of conversation around the coronavirus, I'm hearing newscasters and neighbors alike mixing up three important words my colleagues and I use in our work every day: outbreak, epidemic and pandemic. Simply put, the difference between these three scenarios of disease spread is a matter of scale. Outbreak. Small, but unusual. By tracking diseases over time and geography, epidemiologists learn to predict how many cases of an illness should normally happen within a defined period of time, place and population. An outbreak is a noticeable, often small, increase over the expected number of cases. Imagine an unusual spike in the number of children with diarrhea at a daycare. 1 or 2 sick kids might be normal in a typical week, but if 15 children in a daycare come down with diarrhea all at once, that is an outbreak. Epidemic. Bigger and spreading. An epidemic is an outbreak over a larger geographic area. When people in places outside of Wuhan began testing positive for infection with SARS-CoV-2, which causes the disease known as COVID-19, epidemiologists knew the outbreak was spreading, a likely sign that containment efforts were insufficient or came too late. This was not unexpected, given that no treatment or vaccine is yet available. But widespread cases of COVID-19 across China meant that the Wuhan outbreak had grown to an epidemic. Pandemic. International and out of control. In the most classical sense, once an epidemic spreads to multiple countries or regions of the world, it is considered a pandemic. However, some epidemiologists classify a situation as a pandemic only once the disease is sustained in some of the newly affected regions through local transmission. To illustrate, a sick traveler with COVID-19 who returns to the US from China doesn't make a pandemic, but once they infect a few family members or friends, there's some debate. If new local outbreaks ensue, epidemiologists will agree that efforts to control global spread have failed and refer to the emerging situation as a pandemic. If you like this video, click the like button and subscribe to my channel.